I've been unwell probably now for 3 or 4 years, having initially some heart issues, for which I've had various treatments over a period of time. I had a bit of an accident here at home and ended up in hospital for a couple of days, a little bit sort of battered and bruised. And I think maybe I then became noticed by the complex care team.
I've been working with the complex care at home team over the course of the last 18 months or so. This is a new service which is going to proactively try to work alongside GPs in anticipating patients who may encounter problems further on down the line.
So Complex Care at Home service is a new service that started in April 2018. It's full of highly skilled professionals with backgrounds in respiratory, diabetes. We've got people that are from rapid response, we've got dietitians, district nursing based backgrounds, we've got heart failure nurses as well. Huge vast amount of people. We work very closely as a multidisciplinary team, and we work with social care. We've got care navigators, we've got physiotherapists, occupational therapists.
I'm very much, a one-man sort of band, as it were. But luckily, in the background are people like the complex care. And the last thing Lisa always says when she goes, "Dave, you've got my phone number."
Complex Care at Home is a truly person-centred service that supports people to be the best that they can be. We use health coaching techniques and methods that enable people to take control of their own health and well-being.
We do a very holistic, very comprehensive assessment of our patients initially, so that we can look at the environment, social side, the aspects. We look at their health as well and their medication. We look at their long-term conditions. We do a lot of the medical aspect initially and make sure that their medication is correct. Then after that, we then look at the social aspect and see what we can put in place, which is going to improve their quality of life and their health and well-being. So that could be anything from equipment to social activities. We could look at therapies, different things like that to hopefully get people out and about a bit more.
They cover a breadth of specialities and a breadth of experience. So there are experts in dementia care, there are experts in clinical care, in addition to things like heart failure, breathing problems and falls. So altogether that could be very constructive. It can mean that someone's difficulties may be better addressed.
Wellbeing coordinators, they're key to this whole process as well. Once the matron has done what she needs to do, or he needs to do, then we then pass the care on to our wellbeing coordinators, who are not nurses by background, but they are there to support and encourage and continue to motivate the patients to get to the point where they will reach their goals and hopefully set further ones. The idea is that people will take more control of their life, and they will become more independent, and they will manage their own long-term conditions effectively.
As a care navigator, we support with non-statutory care needs. We help individuals and families with connecting them with community resources. For example, the Fire Safe and Well service, onward referrals to our life links and our telecare. We also support with befriending services, trying to source information and advice, benefits, and looking at domestic support and around pets as well.
People are referred in through their GPs or through hospital admissions. So if they've had a fall, for example, and they've just come out of hospital, they can refer into us so that we can help improve their confidence at home, so hopefully prevent another fall. You can have other healthcare professionals that can refer into us, so other specialised services.
It can make a huge difference to people's lives. because it could be that family feel someone or their relative is not safe at home, when actually we can put things in place or we can support the actual individual to be safer at home.
We also support people with low-level anxiety and depression, particularly related to long-term conditions, which many of the people who use the service have multiple long-term conditions.
It is possible, but I wouldn't have got through the last sort of 6-8 months without the help of the complex care team. I'm lucky the fact that they're there.
It's very much person-centred. They're looking at the whole of the patient. They're looking at some of the obvious problems, but also the things that really matter to that patient and their family, rather than just focusing on what might have historically been health-related issues. But it's about quality of life at a time where they may be encountering quite a number of difficulties which are just making life harder all round.
It is really fulfilling when you get your patients that are telling you that you've changed their life, and they would be in a very different place if we hadn't intervened or come in and worked with them. So it's really nice to know that you've helped somebody and that you've improved their quality of life.